Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. We've got that free 31-page PDF. It's a no-brainer, top 200 study guide. I lay out some of the most important things that you're likely to be tested on in pharmacology courses and board exams and so on and so forth. So simply an email will get you access to that. All right, so the drug of the day today is Darifenacin. Brand name of this medication is Enablex. This is an anticholinergic agent used in the management of overactive bladder. Dosing of this medication is usually just once a day. It is an extended release formulation. Usually 7.5 milligrams once a day, and then can be increased after a couple weeks if needed, up to 15 milligrams once a day. Important to note, it being extended release with the administration, it's definitely not recommended to crush or chew this dosage form. So if it's too big or you've got a patient with swallowing difficulties, you better recognize that we may need to switch to an alternative medication, alternative anticholinergic, if that's the class we're looking to use. So something like tolterodine, for example, or oxybutynin, those type of medications there. Digging deeper a little bit into the mechanism of action. So how do anticholinergic agents help overactive bladder? Well, the specific receptor is the M3 receptor, also known as the muscarinic receptor. And what darifenacin does is it's an antagonist, or it blocks the M3 receptor, and this prevents acetylcholine from binding to that receptor and ultimately activating that receptor. So this blocking, or the prevention of acetylcholine binding there, what acetylcholine does when it does bind is it causes bladder contractions, and in overactive bladder, this is basically inappropriate or excessive signaling for that bladder to contract, even when we don't necessarily have a full bladder. So it's kind of that physiological process that's kind of malfunctioned a little bit, where we get that excessive contraction. And a drug like darifenacin and other urinary anticholinergics can kind of try to reduce that inappropriate bladder contractions. All right, let's get into adverse drug reactions. As you could imagine, anticholinergic adverse effects are going to be a concern with a drug like darifenacin. So dry mouth, constipation, dry eyes or blurry vision, urinary retention, can have central nervous system adverse effects have been reported. With that said, trospium and darifenacin tend to be on the lower end of the scale. A drug like oxybutynin, which I've covered in previous episodes, that definitely has more central nervous system action. So where this comes into play in practice is if you've got a patient, let's say with dementia or with cognitive impairment already, we don't want to add drugs that are going to worsen that potentially. And so if you needed a treatment for overactive bladder, you'd probably consider trospium and then maybe darifenacin as well, if the patient wasn't a trospium candidate either. So again, that's that CNS penetration, CNS activity tends to be a little bit lower, which is what we want with these agents. We just want them acting at the bladder tissue and not getting into that central nervous system and causing problems there if possible. Other rare things as far as adverse drug reactions go, patients may be more susceptible to heat or have heat intolerance. So it usually maybe not quite as big a deal in northern climates, but if you're in southern hotter climates, patients may not be able to tolerate heat quite as well. So that's an important thing to note there. And then rarely anticholinergics can contribute to tachycardia. not something I usually crazy worry about, but if I have a patient that's having issues with that, anticholinergics have been associated with that tachycardia. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, NAPLEX, ambulatory care, BCMTMS, geriatrics, go check out meded101.com/store. We've got a great list of resources. Helped thousands of candidates prepare and pass their board exams. So definitely your support there helps support this podcast and keep it free and available for all to benefit from. If you're a pharmacy technician, a nurse, PA, nurse practitioner, med student, we've got a ton of resources. I've got Perils of Polypharmacy. That's a great case study book for anyone practicing in geriatrics, whether you're an NP or a physician. We've got Drug Interactions in Primary Care, nice little book that goes over some of the most common drug interactions and issues there. And then we've got a crossword puzzle book for pharmacy technicians. We've got a pharmacology crossword puzzle book if you're studying and preparing for pharmacology exams in school. We've got a nursing pharmacology book as well. So tons of resources all listed, meded101.com/store. All right, let's wrap up with drug interactions. And there are definitely some to pay attention to with darifenacin. So first and foremost, CYP3A4 is a significant pathway of breakdown for darifenacin. So naturally, if we have any drugs that inhibit CYP3A4, that could increase the concentrations of darifenacin and obviously increase the risk for some of those adverse effects like dry mouth and constipation and so on and so forth. So definitely pay attention to that. Kind of classic CYP3A4 inhibitor, grapefruit juice, for example. Those can, again, increase those concentrations of darifenacin. And then we've got darifenacin itself causing CYP2D6 inhibition. So by darifenacin inhibiting CYP2D6, it can increase the concentrations of many, many other medications and ultimately increase the risk for adverse effects and toxicity there. So some common agents that may have their effects increased by darifenacin include some of the antipsychotics, aripiprazole, Haldol, risperidone. Some of the amphetamine and amphetamine derivatives can be affected by this. Tamsulosin concentrations can be increased. Doxepin, dextromethorphan, metoprolol, paroxetine. These are all drugs that are broken down by CYP2D6, and with darifenacin's action of inhibiting CYP2D6, concentrations could go up and we could increase the risk for those various toxicities based upon the medication that we're using there. With CYP2D6, I've also got to mention tamoxifen. So tamoxifen is actually a prodrug activated by CYP2D6. So if we block CYP2D6, we're actually going to reduce the potential action of tamoxifen. So remember, tamoxifen is used in the management of breast cancer, which could obviously be a really, really serious thing if we're blunting the effects and benefits of tamoxifen there. So definitely an important one to pay attention there with regards to darifenacin. Other potential drug interactions that I think about, so we've always got to think about the additive effects, particularly with anticholinergic activity. So, a lot of your first generation antihistamines, like diphenhydramine, for example, are highly anticholinergic. They could have additive effects, to that dry mouth, the constipation, the, dry eyes, confusion, drowsiness. Definitely an important class of drugs there when it comes to anticholinergics. Some older skeletal muscle relaxants have some significant anticholinergic activity. Antidepressants like the TCAs, so that's your amitriptyline, your nortriptyline, they're generally pretty highly anticholinergic and could certainly add on to that. Some of the antipsychotics have some anticholinergic activity. Clozapine is one that comes to mind as having higher anticholinergic activity. And some of the first-generation antipsychotics tend to have some anticholinergic properties as well. So again, all additive effects can all make that adverse drug reaction profile a little bit worse there. And then I also wanted to mention with the anticholinergics, LAMAs. So those are the respiratory anticholinergics. So a drug like tiotropium, for example, this can certainly have additive effects. Usually, in my experience, probably the biggest issue is dry mouth, because those drugs tend to act a little bit more locally and less systemic effects. That dry mouth tends to be problematic when adding it on top of other anticholinergics like darifenacin. And then last but not least, I wanted to mention prokinetic agents. So sometimes in gastroparesis, we use a drug like metoclopramide. Keep in mind, a medication like darifenacin can kind of slow down the gut and basically directly oppose any beneficial effects that we're looking to have from that metoclopramide in managing gastroparesis. So just a little practice nugget there that I think is important and certainly has come into play for me at times. All right, well, I think that wraps up the podcast for today. If you have any comments, suggestions, mededucation101@gmail.com. I greatly appreciate anyone that takes the time to do a rating or review on iTunes or wherever you're listening. I greatly appreciate that. It helps me reach a broader audience. And of course, sharing our podcast as well in, class listservs or pharmacy students or medical students or nursing students. You all sharing the podcast has helped it grow immensely, and I greatly appreciate that for sure. Don't forget to support the sponsor. Any purchases at meded101.com/store will go directly to help support this podcast and keep it free. I greatly appreciate it. To all of you who have made purchases already, I can't thank you enough. Definitely really, really appreciate it. Sincerely do. So with that said, I'm going to sign off for now. Thank you so much for listening, and I hope you have a great rest of your day.